There's a lot of treatments that utterly fail when it comes to management of trigger points, and this is the last one in the series for a while, but it's really important. Most patients with pain understand they should go to a physician or a surgeon first. Some people directly go to therapists and massage acupuncture directly, that's their choice, but you don't want to do that. You want to make sure you're not missing a serious thing. And most of the time it's not serious, but it's easy to say that having seen so many cases. You still want to do the basic workup. Why? When you look at treatment, there's two types of practitioners. One kind is a technician. The technician benefits from doing procedures to you. The other kind benefits from seeing you get better. Obviously, you want the second kind in your care, somewhere in there. That's what physiatrists do. We don't benefit from getting therapists to put machines on you. We don't benefit from putting needles in you. If you get better, we're done. But then that means we actually treat the root cause of what's going on. And that's where things become a problem, because if your problem would be being overstimulated from too much social media or too much screen use or poor posture, needles, acupuncture, all those things, they don't fix it. They temporarily cover up the symptoms so you can feel good, and that's about it. Now, the typical cycle of this kind of treatment follows a very particular history, and it's interesting to note. Many times myofascial trigger points emerge, they're sore for a few days, they might go away on their own. If there's enough of them inside of a muscle, it might really start to hurt, or it might start to radiate into different parts of the body, down the fingers, down the legs, into the buttocks, etc. Now, if that happens, people might come into a clinic. If they get medication, standard guidelines say 2 weeks of medication. Most people don't continue because if they get better, they're fine. If they take more than 2 weeks, their kidney or stomach get affected. But usually within 2 weeks, a myofascial trigger point will become inactive. It doesn't mean it goes away and is less of a problem. It's still there, but it's not active. Now, the same thing can be achieved with therapy machines. 4 to 5 days of therapy machines can reduce pain by about 50%. But what do you do after that? You're supposed to exercise, lose weight, work on your nutrition. And that's why people keep on failing. That's why they keep on coming back to us. They get immediate relief and they go back to doing whatever caused that pain, whatever drives and makes that myofascial trigger point exist, and it keeps getting worse. This is why pain is so badly mismanaged by everybody involved, and it's not tablets, it's not therapy machines, it's you.